Okay, so we've done active, passive, resisted, and now we can look at stress tests. And the stress tests that we'll be looking for will be the major ligament here, which is the oblique ligament of the TMJ. And this is basically running from the zygoma back to that superior ramus, so it's running this way. And this one will be tightened up as we open the mouth, and then to stress it, we'll simply pull down to the floor that way. And that will apply the stress. We have the spheno and stylomandibular ligaments that come off the sphenoid process and the styloid process respectively, and one comes to the outside of the jaw and the other one comes to the inside of the jaw, like so. So they're running at about a 45-degree angle. To stress test these, I'll keep the mouth closed, or at least as closed as my thumb will allow it, and then basically I'll pull the jaw at about a 45-degree angle, like so, to separate these two attachments. And then we have the capsular ligaments that are running from the articular eminence back to the head of the mandible, one on the inside and one on the outside. And to stress test these, I'll actually be pulling from the other side, but in fact what I'll need to take this backwards to separate it from the articular eminence. So I'll pull the left side of the jaw forwards and twist it to try and take that mandible head back towards the mastoid process. Okay, so with the glove on. Now, you may find that your patient has sharp teeth. If that's the case, then just put a tongue depressor on the lower teeth, because we're going to come into this position. We're going to put the thumb along the teeth this way and grasp the mandible. Okay? Stabilise the head, and then we can do these stress tests from this position. Okay? So, coming in. This is where the front of the glove's held up. Stabilise the head again. Slide your thumb along the lower teeth and grasp the jaw. Relax for me. Let them relax their jaw. Now, to stress test this lateral temporomandibular ligament, I'll open the jaw as wide as it will go, and then basically pull it straight down to the floor. There. And like any other stress test, I'm looking for a reproduction in pain and an excessive end fill. Does it shift when it shouldn't shift? In which case I've got at least a grade 2 tear in this ligament. For the spheno and stylomandibular ligaments, my hand will be in exactly the same position, but this time I'll have the jaw more closed. Just relax there. So there's just enough room for my thumb, and now I'm going to pull down towards his knee. There. And this will test the left ones. To test the right ones, I'll walk around and do it on the other side. Okay? Now, to test the capsular ligaments on the right side, I'll be on the left side of the jaw. And what I'm going to do here is pull it forwards, protract the left side, and then twist the jaw to drive this mandible head backwards away from the articular eminence, and so stress these ligaments that are running from the articular eminence. So it'll be a protraction on the left side and then a twist to the right. Okay? So we've done active, passive and resisted testing. If we find that we do have a ligament tear, or there's any other condition, muscular or so forth, that we can treat at this point, we should do. And if we have an acutely inflamed joint, then we'll pick it up here. Now, we can then do ultrasound, knowing where we are. If we want to do it to the ligament, we need to get right on it. If we need to go to the joint, we should know where that is. We can use ice, TENS, which is particularly effective, particularly if you put small electrodes down on the angle of the jaw and use about a 2 cycle per second frequency. Okay? But basically, when you've got an acute problem, you're going to be treating it mostly with rest and ice.